my name is Edie, and I work for an architecture firm. I've been there probably about 25 years. I'm located in Pittsburgh, Pennsylvania, in a suburb, and I've lived here pretty much all of my life. As far as hobbies, I love to swim and do yoga, crossword puzzles, reading, cooking. 3 words to describe me, I would say meticulous, optimistic, and curious. I had breast cancer about 27 years ago. I was stage 1. I opted for chemo only to give myself the best result, and I also had radiation of my left breast, not realizing at that time that my heart could be damaged. So about a year after, when I was done with all my treatment, I went to my doctor and said, I'm still tired, I have trouble walking up hills and stairs and carrying heavy loads, using my arms for things like hanging clothes on a clothesline. So he thought I had asthma, put me on asthma meds for a year, gave me a nebulizer, really didn't give me any kind of an exam other than a general fitness exam. And after about a year, and I still wasn't feeling better. So I asked my new PCP, he ordered an EKG and an echo, and then called me one evening, Friday evening in fact, to tell me that my ejection fraction was only 15%. It should have been 55 to 65. My health doesn't really give me a bad day. I feel frustrated when I can't do the things that I want to do. But as I said before, I'm very optimistic, and I want to do everything and wanted to do everything I could. At my time of diagnosis, I had a 10-year-old, a 13-year-old, and a 16-year-old, and all my thoughts were, I need to be here to help raise them. As far as emotional or mental, I've always had a very positive outlook. I may have been discouraged at times and frustrated, but for the most part, my whole attitude has been, I am going to do whatever I can to get better or to live as best I can with this health issue. So I started with a cardiologist. He put me on an older beta blocker, Inderal, for a year. I was reading a lot about Corig, but he was hesitant to try it because I normally have low blood pressure. Oh, and at the time of diagnosis, when they told me I had heart failure and also that I would probably need a heart transplant in 5 years, I laughed because I didn't believe it. I didn't feel my normal self, but I wasn't that bad off. However, that cardiologist was absolutely correct. In 5.5 years, my heart failure went from stage 1, which is little or no symptoms only on exertion, to stage 3, stage 4, where it was difficult to get out of a car, push a shopping cart, do any kind of activity whatsoever. I had to cut my work days down to 2 days a week. And at that point in time, they inserted a biventricular pacemaker, which I've had since 2005, and it gave me my life back. I have an active role in treatment, and that holds true for all my health issues, heart, cancer, whatever. I use the internet to find out things. Prior to the internet, it was the library, but that information was usually 10 to 15 years old. I use the reputable websites affiliated with hospitals or associations such as the American Heart Association, Cleveland Clinic, Mayo Clinic, anything that has an actual educational status, nothing that is just off the wall, somebody started a website. Patient support boards are good, but you have to check them out and decide what is something that would help you. I found one where I could ask questions before I had the pacemaker inserted and was very much reassured throughout that journey. What was important to me is to always know what's going on and also to have a voice in my treatment. Patient choice is very important. I know that some people would rather their doctors make all the decisions. That's not me. I always want to know what's going on, what I can possibly do. If a treatment is not for me, why not? The benefit is that I'm fully invested in my health. The only challenges I can see is if you have a physician or a health professional that does not agree with you, and in that case, you find one that does. I have a blood pressure monitor and purchased it right at the beginning or the onset of my symptoms, and I've recently replaced it for an updated model. I monitor my blood pressure probably weekly at this point, but for a while there. In the recent past, I've been doing it on a daily basis, twice a day. I keep a written record of that particular, of the results, and then I speak to my doctor about it. There's also a monitor for my pacemaker, and it resides in my bedroom, records nightly, I guess, my heart rate. I'm not sure exactly what it records, but I know it's my heart rate, and if I've had any incidents, I assume that my pacemaker records these and the monitor uploads it. I do know that a nurse reviews it every week, and every 3 months a doctor goes through all the recordings to make decisions as to further treatment. I'm invested in what's going on with me, and I have a greater awareness of what is possible for treatment or outcomes, that sort of thing. My doctor has a better idea of what's going on with me, and it's not so much that I receive a benefit, except I do have a report every 3 months that's online that I usually download and check, and I usually save it as a PDF on my computer. It would be really useful to have an app that could keep all of this information in one place. My advice to another patient would be to learn as much as you can, and if there are things you don't understand, ask your doctor or your doctor's nurse. Be very proactive in your treatment. Find out everything you can. Check online different sources, any reputable websites. Find a patient support group online where you can read other people's experiences and also post questions. We have to be positive. I survived breast cancer back when it was still, not that it was a new disease, but the treatment options were changing. And I've always been very proactive in whatever treatments for breast cancer or heart failure are possible for me, and it's made all the difference in the world. Having a positive outlook and thinking about just the fact that you have to be here for your family, for your friends, for your bosses, and just for yourself. And always expect that you will do the best that you can do.